Our administration's been working tirelessly over the last several months to both prepare for and respond to Tripoli, whether it be collecting mosquito samples and testing them through the state lab, working with local boards of health and mosquito control projects to conduct ground spraying, or conducting several rounds of aerial spraying, which occurred in Bristol County, Plymouth County, Middlesex County, Worcester County, and Norfolk County last night, and will continue throughout the week. I had the opportunity to meet with some of the local folks about what's happening here in this community, and I can say that they have a dedicated team that's very focused on keeping their residents safe from Tripoli. But even as the evening temperatures start to cool, it's important to remember that the mosquito season is not over. First and foremost, people have to take personal precautions to protect themselves. Wear insect repellent and long sleeves and pants when you're outside. Drain any bodies of standing water around your house, and that includes things like cleaning out your gutters. Repair your window screens that may have holes in them, and avoid peak mosquito activity, which is typically dusk to dawn. We appreciate that in critical and in high-risk communities, many evening activities, movie nights, football games, and sports practices may have to be rescheduled or moved indoors. These protective measures are necessary and should continue. I want to thank all of the town officials and schools and athletic programs who are working to make sure that they take precautions on behalf of their citizens, their students, and their athletes. I also want to thank our partners in the legislature who've worked closely with us to spread awareness. And I also want to point out that as we head into the fall, we'll be working with the legislature to make sure that we have the resources to both pay for additional state spraying and state monitoring activities, and to also make sure we're in a position to reimburse cities and towns for ground spraying and for other activities associated with this on their behalf as well. I want to urge people once again to take precautions to protect themselves and their family members, and to check mass.gov/EEE for updates. At this point, I'd like to introduce Secretary Katie Theorides from the Executive Office of Energy and Environmental Affairs, who can speak more to the aerial spraying activities and how we're supporting local communities with respect to this issue.
Thank you, Governor, and thanks to the community of Lakeville for hosting us here today. I'd also like to thank Commissioner Burrell, who will speak next. Their partnership, working together, the Department of Public Health and our Department of Agricultural Resources on this issue has been critical. Our Department of Agricultural Resources oversees the State Reclamation and Mosquito Control Board and has been working collaboratively with DPH to address this important public health issue since the middle of the summer. After DPH declared a public health hazard due to critical EEE risk levels last month, the Department of Agriculture and the board quickly took action to authorize and enable emergency aerial adulticide spraying to reduce mosquito populations that transmit this virus to humans. Aerial spraying is conducted by aircraft beginning in the early evening and continuing up until 4:30 a.m. the next morning in areas of concern. Specific areas that are excluded from the spray include open drinking water sources, registered organic farms, and certain habitats related to state endangered or critical species, and these are determined before each spray is conducted. Before beginning these aerial spray operations, the Department of Public Health and the Department of Agricultural Resources notifies all of the stakeholders involved, including local municipalities and public officials, legislators, schools, environmental and agricultural organizations, and we issue press releases to the media as well. An important constituent we also reach out to in this effort is local beekeepers. Aerial spraying for mosquitoes took place in parts of Bristol and Plymouth counties on August 8th through 12th and August 22nd through 25th, and in parts of Middlesex and Worcester counties, August 26th through 27th. During these three aerial operations, over 1 million acres were sprayed. And as you can imagine, it's a significant effort for both of these agencies as they work to coordinate this, to manage it. Our Department of Agricultural Resources is in charge of regulating pesticides and pesticide application. After DPH assessed the latest EEE data, a second public health hazard was signed on September 9th, 2019, so at the beginning of this week. And the Department of Agricultural Resources has been able to re-engage the contractors who fly the planes to recommence aerial spraying over several evenings in Worcester, Middlesex, and parts of Norfolk counties to respond to the increasing level of risk. Spraying began on Tuesday evening with a proposed spray zone totaling 555,000 acres. All of these aerial spraying activities are really weather and equipment dependent. So conditions are assessed on a nightly basis, and each night we may not be able to cover the same amount of ground, but that is determined in terms of overall efficacy results. The pesticide that's used is called Anvil 1010. It's a product extensively tested and used both for ground level and aerial spraying in the U.S. to control mosquitoes, and there are no health risks expected during or after spraying. Aerial spraying is not expected to have any impacts on surface water or drinking water, and again, it's being sprayed at night when other insects are not active and when people are in their homes. Additionally, the Commonwealth's mosquito control projects have been conducting truck-based ground spraying, larviciding of aquatic habitats, and mosquito trapping. Spraying for mosquitoes doesn't eliminate the risk of EEE transmission, and this point is really important, and you'll hear much more about this from Commissioner Burrell. This is not, the first line of defense really continues to be using bug spray, wearing long sleeves, staying inside during the hours from dusk to dawn, and really personal protection to reduce your risk of mosquitoes. And so we ask the public to continue those practices, and you'll hear more about that from the Commissioner. In closing, I'd just like to thank the Governor and the Lieutenant Governor for their continued support and dedication to this effort, for our local legislatures for their support, and to all of the communities who have really stepped up and taken this issue seriously, whether it's closing their parks, adjusting schedules, dealing with some of the ground spraying that needs to be done, and continuing to educate their residents. We really heard about some of the great work that's been done in Lakeville today during the roundtable on efforts to do the proper outreach to residents. So thank you for that. I'll turn it over to you, Commissioner.
Thank you so much, Secretary. It's very good to be with all of you here this afternoon to discuss this important issue. As you've heard the Governor say, the most important message for us all to share at this moment is about personal protection. It's very important for all of us to protect ourselves and our loved ones by making sure to avoid being outside from dusk to dawn, wearing long sleeves, socks, wearing approved mosquito repellent when outside, and making sure there's no standing water around our homes. As you can see, at the state level, we're doing everything we can to control this virus. When we talk about this virus, Eastern Equine Encephalitis, it's a virus that, as we all know, is carried by mosquitoes. It was first noted here in Massachusetts in 1938. It's rare. There's been about 108 cases since then. But it is serious. The virus infects our central nervous system and can cause this encephalitis or brain swelling. And unfortunately, up to half of the patients infected with it do die, and a great majority are left with neurological defects. And my heart really goes out to those families who have been affected by this terrible disease. So it's very important for us all to protect ourselves, protect our loved ones, and become educated and share this information. At the state level, we have a mosquito surveillance plan that we follow every year. And months before summer starts, we begin implementing those plans, which include trapping mosquitoes across the state. Those mosquitoes are then brought to our state lab and tested at the Public Health State Lab to see if they contain both West Nile virus and Tripoli virus. We then push out alerts based on risk, do public communications, and of course, spraying. As part of these efforts, we're very, very much reminded to continue in your efforts to help us remind everybody about personal protection. Again, the Governor mentioned the website mass.gov/EEE, which you can find information and further details. And I would like to take a moment to thank our state epidemiologist, Dr. Katie Brown, and our entire staff at the State Public Health Lab who have been tremendously working on this issue. Thank you.
So before we take some questions, when people talk about mosquito trapping, I I think it's important to point out that that starts usually pretty early in the spring, runs all the way through the fall. And we're not talking about a few mosquitoes here. We're talking about hundreds of thousands of mosquitoes that get trapped and tested over the course of the summer months. And the larvicide activity typically starts in the spring, and the spraying obviously begins once people have some sense about where they need to be most concerned about the prevalence based on the mosquito testing that's done. Questions?
Is there any hope for a vaccine if there work underway for that?
You're right, there is a horse vaccine available. There is, a widespread vaccine available to all individuals is not there at present. If you think about vaccines in general, because this is such a rare disease, it doesn't get that kind of attention. There is a vaccine for horses at this time, but not for humans.
Is it a financial issue where it's not lucrative enough because there aren't enough cases?
I can't speak to the manufacturers of the vaccine, but I think suffice it to say at this point there's no vaccine available for humans as a general use.
We've heard the concerns from many people calling us saying they're concerned about the effects that this spraying has on their health. And I know you said there's no health effects to that, but the fact that of water and organic farms makes some people concerned. Well, if it can't be sprayed there, why is it okay for our health? Can you explain that?
And I understand the concern that individuals have. These are well-tested, used in many different incidences, and there is no evidence of human health impacts from these sprays.
Governor, on the flip side of that, is there any thought moving forward to proactively doing aerial spraying next year? Because by the time you do it, it's because there's a number of human cases or horses that have died or a high number of mosquitoes that tested positive. Should it have been started sooner, or do you just wait until you see the results to do it?
Well, I'm going to let the experts speak to this, so I'll get it wrong first and let them clean it up. But I think what I would say about that is people have been pursuing a particular strategy with respect to this for a long time. And the preventive piece of this strategy starts with the trapping. And the reason I talked about the fact that we're talking about trapping hundreds of thousands of these mosquitoes and testing them is to make clear that we're not talking about trapping handfuls. Starting pretty early in the year, probably in the spring, probably as early as May, people start trapping and testing. And the decisions with respect to where to spray literally grow out of the data that they collect from those initiatives. They also larvicide in the spring, which kills many of the mosquitoes and a lot of the key bodies of water that are associated with this as well. I think the thing I wonder about, we don't have the statewide map up, the thing I wonder about with respect to next year, with respect to the preventive issue on this is, this starts with mosquitoes that don't bite people biting birds. And then those birds get bitten by mosquitoes that bite people and transmit the disease to those mosquitoes, which then turn around and bite us. This has primarily been, for as long as I can remember, and I was worrying about this issue when I worked at Health and Human Services in the 90s, it's mostly been Bristol and Plymouth counties. That's really been where most of the effort and most of the work that's been done on this has taken place. Now, over the course of this particular season, it's moved onto the Cape, up into Norfolk County, over into Worcester County. It's in places we haven't seen it before. I assume that has something to do with the flight patterns associated with the birds. It might have something to do with something else. But I do think it means next year, as we start planning for this activity in the spring, we're going to need to start planning on a much broader geographic radius than the one we've planned on historically. Yeah.
Governor, is it bad enough? Is it at the point where you might consider a statewide ban on nighttime activities? I know towns are doing it town by town at this point.
It's not a statewide issue at this point. I mean, you guys should speak to this. I take most of my guidance on this from the epidemiologists and the people who know more about this than I do, but you should probably speak to
Sure,
that.
absolutely. So the precautions that we have are general precautions, but if you look at the map, you'll see it's roughly about half of the states that impacted at this time. And if you look at our surveillance plan, you'll see that there's very specific criteria, whether you're in a moderate risk, a low risk, a high risk. So we really are following that that plan. Overall, all of us in general should avoid mosquito bites if we can with personal protection. And the spraying that we do is meant to bring down the burden of the mosquito population in general in those highest risk areas.
Has the peak, the risk peaked, and how long will people have to be concerned about this? Is it the first freeze?
The risk for mosquito bites continues until the first freeze. So one of our most important messages for the public is that September continues to be a time where you need to continue these precautions.
And based on the widespread nature of this year's outbreak, do you think that it will be big next year? Does this run in cycles, or can you tell this far in advance?
Triple-E does run in cycles, usually a couple of years at a time. Many of these questions speak to what we're doing next year, and we really pay close attention to how we structure our plan for each year based on the year before, based on our looking at what happened in that year and planning for the next year.
The other thing I'd say in response to that particular piece is if you have a wet fall, a soft winter, and a wet spring, that's usually a signal that you may in fact have a difficult year with respect to Tripoli, which is why people were out larviciding and starting to collect and trap in May, and doing a lot of the preventive and surveillance work pretty early. But it does have the tendency, there is an echo in this, I guess is the way I would describe it. So people are going to be out pretty early next year working this as well.
Governor, do you think what makes this so scary is that, I mean, any one of us could be sitting outside on your porch, get a mosquito bite? I mean, it's just so broad in general.
Oh, I think this is a very scary issue for people. And it's one of the reasons why the Commonwealth for decades has had a pretty aggressive program in place working in conjunction with our colleagues in local communities, and especially those communities that historically have shown the greatest risk associated with this. I think the fact that people put a tremendous amount of time in, I mean, trapping and testing hundreds of thousands of mosquitoes. The amount of the amount of knowledge Dr. Brown has about there are 51 species of mosquitoes, okay, and I want you to imagine getting thousands of mosquitoes at the state lab and then separating each one of them one at a time to find the place where you're going to test them. I mean, people put a tremendous amount of effort into this for exactly the reason you raised, which is we need to know where the problem is. We need to be able to apply resources to deal with the problem and do everything we can to limit the possibility that somebody's going to get affected by it.
Last question.
If you're bit by a mosquito, how do you know, do I call the doctor, do I go to the hospital, do I wait, what's the protocol?
So the majority of mosquitoes are not carrying Triple-E. So if you're bit by a mosquito, you don't need to go to medical attention for that. When Triple-E first presents, often people can have flu-like symptoms. They then may develop a headache and then have some other neurological effects. It's at that point when they're starting to get more ill that they should seek medical attention. Thank you.